bruises, no scratches, no nothing.
All right. So now you can hear me. Let's see. Let's make it so you can see me. There we go. All right. Welcome to Overcoming Peripheral Neuropathy. Peripheral neuropathy is miserable. Yeah, you know that.
Yes.
So we want to overcome it. And so overcoming neuropathy, your roadmap to relief and healing. And we want to give you another way. There's lots of talk out there about solving peripheral neuropathy, things you'll find online, and although you go to your local medical doctor, and often they'll just say, well, here's some gabapentin, here's some Neurontin, and hopefully this will make you feel better. But of course, neither one of you think it's going to actually improve anything, heal anything. It's just going to cover things up until it gets worse and it doesn't work anymore, or the side effects of the medication are too bad to handle. So I want to give you a new perspective on neuropathy, but also health and life, because we want to heal this from the inside out. And we want this to be more than information. We want it to be transformation. So you're investing by just coming here. So you're committed, and so I appreciate that, whether you're online or in person. All right, so I'm going to start out with my story. So my grandfather, this is my grandfather. When I was, this is my grandmother, so we call them Granddad and Granny. Those are their names, right? And when we lived in the same town as them for a while, and when I was about 7, moved out of town, moved to a different state. But I would come back for the summer and spend some time. And so I was pretty close to them. And I remember one time I came back, I was 9 years old, and they said, Granddad is sick. I was like, okay. So went and saw him, and he was in a nursing home. So went in there, walked in, and he kind of looked the same, you know, and acted happy, and his other family members were there. And he didn't know who I was. And I didn't know how to, I'm sure my parents had warned me, but I cried and I left, and I never saw him again until he was in his casket, at least that I can remember. So it was pretty hard on me. So that was neurodegeneration. He had Alzheimer's disease. Now we know that with a lot of people. So neurodegeneration can affect the brain, and it can affect the feet. My neuropathy. So I had neuropathy in my feet, and I had to work to regenerate. It wasn't very bad, but it was, you know, it motivated me to find some solutions, right? Right. And my mother-in-law recently died with Alzheimer's disease. My wife cared for her for 5 years, like 6 hours a day, and she didn't know who she was. She didn't know who her daughter was, right? But she thought she knew. She was her friend from high school, and it's kind of funny, and it was funny. We tried to make, but she would actually talk bad about her daughter to her friend from high school, who was one and the same person, right? So that was pretty rough. So I'm driven to find solutions for myself and for others so people don't have to go through the same kind of suffering. That brings me here, and that brings you here. So this is my wife and I. And so we like to go do adventure stuff. And so if you follow us on Instagram or Facebook, then you'll see all of our little adventures. Make it short and sweet, but I try to post a little something, because that's what we like to do with our health, is go out and do stuff, right? Show them what your health. Yeah. So, and so that's kind of, just enjoying nature, enjoying life. But also we want to serve others with our health. All right. So whether it be family or friends or church or community. And so we have a reason for our health. And it's, so we invest in our health so we can invest in others. So who am I? So family chiropractor since 1996. That's almost 30 years now. Focus on nervous system and chronic health. That's always been my focus. Chiropractic neurology, board certified since 2007. Basically, difference between a chiropractic neurologist and a medical neurologist is a medical neurologist will focus on infection, disease, and trauma. That's what all medical doctors focus on, almost. And that's great. We need people doing that. But we also want people who are focusing on wellness. Because if you focus on disease, you're actually never going to learn how to get healthy. You just learn how to be less diseased, which is great. Or you learn how to catch the disease earlier and kill the disease. That's mostly what they do, kill the disease, right? So anyway, certified in functional medicine, that's where we use nutrition and lifestyle changes and functional lab testing to find problems and resolve from the inside out. So the reason we get such amazing results in our office is characterized by this term. We have a different approach. and the salutogenesis. So what is salutogenesis? It's a Latin word. Saluto means health, and genesis, the creation of. So we focus on creating health in your body, we have a much better chance of creating health than if we focus on disease. All right, so I'm going to tell you a story. Actually, Alondra is going to tell you this story. So this is a story about Mrs. Hayes. So you can read that, and you can then... yeah, come on up. You look good. I just made you work all day, so you can just hold it like that. Yeah.
Okay.
And you can kind of ad-lib or whatever you like.
Okay. So my name is Karen Hayes. I was diagnosed with...
Step over just a little bit so people can see you around the world. Okay.
Peripheral neuropathy in 2011, but had symptoms long before that. I saw 2 neurologists. I started... That's a little gabapentin in 2015 and moved to daily Lyrica in 2022. In June 2023, I had decompression surgery, which my peripheral neuropathy became worse. I started tripping and occasionally falling on our staircase. I saw a peripheral neuropathy podiatrist specialist, but got no improvement. I was scared and in pain. I started the thorough evaluation with Dr. Hobbs October 23rd of 23. I do the daily spinal hygiene taught by Dr. Hobbs. It does not take very long and has enabled me to cut back on 3 hours of day of therapies. I was doing to lessen my neuropathy pain. The labs Dr. Hobbs had me do were much more thorough than usual. He found nutritional deficiencies and bacterial overgrowth, explaining the years and years of digestion problems. I shared them with my physician, who was impressed. Today is day 20 of no Lyrica and no pain. Even with 2 storms bringing cold weather, which always sets my pain off, for me, this is a miracle. Also, I don't trip or fall anymore. I am so grateful for Dr. Hobbs.
All right. Anything else you want to add to her story?
How old is she? She is probably like
60s?
60s, yeah. 60s. Let's see. She started feeling a lot more after, I know we talked about this last workshop, but after her like stress levels came down, she started feeling a lot less, neuropathy as well. There's a story.
Well, actually, so her stress, she had, even after she started feeling better, her stress spiked.
Oh, that's right, yeah.
So, because she had just a lot going on. She is a go-getter, owns all kinds of businesses, and a lot of responsibility. And stress had always made her neuropathy get worse.
Yes. Oh, yeah.
But what happened?
After she was able to, I guess, control her stress levels and...
Well, sort of, right? But it was just she had a lot of stress. But her neuropathy didn't get worse.
Oh, yeah, yeah.
So even though her stress was high, which of course we want people to control their stress, but even though she couldn't, her neuropathy didn't get worse.
Yeah.
Yeah. So that was pretty awesome.
Yeah.
All right. Thank you.
Thank you. Awesome.
So, and when she came to me at first, I'm like, after we talked for a bit, I'm like, I don't know if I can help you, because she was doing 3 hours of therapy at home already. I'm like, I'm not going to give you that much to do. She had a red light therapy. She had a rebuilder, which is electrical stimulation, a fancy one, not just, right, stuff that we use here. And I'm like, you're doing a lot of stuff. So we added a little bit of, we did some lab testing for nutrition, we did adjustments, we did laser, and she got better. And that was really exciting. So, yeah, so day 20, that's a long time ago. Now she's been doing better for a long, long time. Okay. So that's pretty exciting.
It is.
All right, so everything I talk about tonight is going to be research references, stuff that's published in books or journals like these. If I give you just my opinion, then I'll tell you, hey, this is just my opinion. But for the most part, this is going to be all research referenced information. That turns the screen off. All right, so what is neuropathy? It's damage, disease, or dysfunction of one or more nerves, especially in the peripheral nervous system. What is the peripheral nervous system? It's the things outside of the central nervous system. Central is brain and spinal cord. So peripheral is all the other stuff. And so like hands and feet, that's where it happens the most. Why does it happen the most there?
It's gone to the end of its nerve ending.
It's the end of the nerve endings, right? And this is longer than that one is. And it has to get nutrients. Up here is actually where the nutrients start for the, there's blood flow to the nutrients, but you have to have some some stuff that goes through the nerve itself. It takes a while to travel, and it has to travel all the way down. It's at the end. So what does it feel like? Well, if you've got it, you know what it feels like. It can be a variety of sensations, but burning or shooting pain, numbness, tingling, muscle weakness, so you can actually have involve the muscle, or atrophy of the muscle, impaired organ function if it's going to organs, usually caused by injury or pressure. So what's that? So that's different than a peripheral neuropathy. This is just neuropathy. So injury or pressure is usually not a peripheral neuropathy. So we'll talk about those. But inflammation can cause this peripheral one, infection, disease, drugs, toxins, or vitamin deficiency, and it's usually progressive, which means it just keeps getting worse. Peripheral neuropathy, when the nerves outside your brain and spinal cord are impacted, typically affects the extremities. We know why now. There's an autonomic type. The autonomic type is the autonomic nervous system that affects body functions and organs, right? So that's the automatic nervous system. Focal, that's like focus on a little spot. Focal neuropathy, where a nerve is compressed by a bone, a muscle, herniated disc, or inflammation. Who has heard of sciatica? Right? Everybody's heard of sciatica, and it's a way overused term because you use it to mean almost everything in the leg. All leg pain is sciatica. It's like, no. Well, it kind of, yes, but it's not. It's almost never the sciatic nerve. Now, a focal neuropathy is the sciatic nerve, and it does happen. It's usually because of muscle compression in the glute area. And you'll feel it though at the end, like in your lower leg. That's where the sciatic nerve has most of its effect. And so when people feel the pain in their glute or their thigh, they're like, oh, I have sciatica. It's like, well, yes, in one sense you do, but it's not the sciatic nerve. So you can have sciatica without the sciatic nerve. In fact, it's usually not the sciatic nerve, which is why I don't like that term. And when they put me in charge of all medical terms of the world, I will change that. Okay, so just get ready. All right, cranial neuropathy. When one of the 12 cranial nerves, where do cranial nerves come from? Cranio, right? From your cranium. They actually don't all come from the brain.
Okay.
But they do all come from the cranium. What's that? You've got something else in your cranium other than your brain. It's your brain stem. Okay, anyway. Like Bell's palsy, that's involving the face. All right, so they'll give you some statistics. 20 million people have some form of neuropathy. This figure is likely significantly higher than 20 million. Why? Well, did somebody call you and ask you if you have neuropathy?
No.
No. So they don't know about you. Maybe they don't know about somebody else too. Okay. They never ask us. Okay, peripheral neuropathy. This is a special kind of neuropathy, the peripheral. Where's the periphery? Outside of the brain spinal cord. All right. So damage to a single peripheral nerve is a mononeuropathy. Right? So one, a lot like a focal neuropathy. Physical injury or repetitive strain, pressure, like carpal tunnel syndrome, right? So we know about that. Now, can carpal tunnel syndrome be affected by your neck? It's carpal tunnel, neck. Yes, it can. Even though there's compression here, the neck problem, actually even the bad posture, can affect your probability of having carpal tunnel syndrome. So, and the nerves come from the neck, go down the arms, right? So, a polyneuropathy, that poly means what? Many. Say it loud and proud. All right. So multiple nerves involved. The greatest, this is the most cases of peripheral neuropathy are polyneuropathies. All right. And this is what we think of as peripheral neuropathy. It's affecting both of my feet kind of about the same amount, and then it's getting bad enough, and now it starts to affect my hands. Can be caused by toxins, poor nutrition, chronic disease like diabetes is a really common cause. Usually shows up first in the feet and the legs, then the hands. Why does it show up in the feet first?
Longer way down with the nutrition.
They're farther away from the nutrition. You got it. You're going to be a guest speaker next time.
Yes.
Okay. Peripheral nerves are like the wires that send electricity to different parts of our house or connect your house to the internet. All right. The nerve signaling in neuropathy is disrupted in 3 ways. It's either a loss of signals, just can't communicate. Extra signals, so you can imagine if this is your internet, it's like, I'm getting signals from my neighbor's internet. There's too much stuff on my screen. Stop it. Get away. Or distorted signals. It's like static. It's kind of going in and out. All these are really problematic. And this is happening with your perception. The signals go to your brain, and you feel them in your feet, or you don't feel them if it's a loss, or if it's added or distorted signals, you're feeling these things. That's no feet sensation, just in case you wonder what the X's meant.
No feet.
Whoa, there it is. That is extra. Okay. Neuropathy is a whole nervous system condition. So the signals go to your brain. They go up your spinal cord from all parts of your body. And each nerve cell needs to be healthy for this to work properly. So for healthy nerve signals and for you to feel and function well. To reach your brain with healthy signals, there must be no interference. Free of spinal dysfunction, because your nerves go through your spine and nerves come from your spine to signal your brain. And free of muscle toxicity and sciatic nerve compression, because that's the one time you do actually have sciatica, that's the sciatic nerve. And free of muscle toxicity. Okay, so the toxins can create a perception of that irritation. And the perception happens in your brain, even though you may feel it in your hands or your feet. That is kind of scary. It's the brain man. All right, applause for the brain man. Good job. All right, so to feel or function healthy, all parts of your nervous system must be healthy, active, and nourished well. So what are the stages of neuropathy? How does you progress through this? All right, there. Oh yeah, there we go. Okay. So stage 1, numbness and pain. This is typically, not everybody progresses through these stages the same. 2 or more regular and persistent symptoms. Stage 3 is intense debilitating pain. This is when people really start asking for help. It's like, this is hurting a lot now. People live with that numbness and a little bit of pain. They live for a long time. It's like, oh, I can handle it. 4 is constant numbness. Now maybe they feel like, well, this is great. Now I'm not really feeling it anymore. But this is when it's most dangerous. Is because now you can't feel, and maybe you just don't feel part of it. So when we test, we see, okay, what threshold of sensory loss do you have? And if that sensory loss is significant, which is that what we call a 10-gram monofilament level, then it's dangerous, and we're like, you need to be looking at your feet every day because you don't know what you don't know. And if you can't feel it, you could be getting cut or infection that could be really scary and dangerous. Okay, so symptoms depend on which nerves are damaged. All right, sensation may be exaggerated, like pain or tingling, or it may die away where you get numbness or lack of sensation. But if it causes a motor problem, motor is to muscles. But these are the ones that start with first, the tiny ones. The damage and nerve dysfunction loss occurs in smallest or largest, typically and initially. So as those nerves are damaged, autonomic, heart rate, blood pressure, sweat, gut, intestines, sexual function. So this is often what people notice going first. It's like, oh, I have heart disease. So, or, I'm just forgetting things, so their brain's not working quite right. Or they're not seeing as well. So these are things that happen with these autonomic or to organs. And then sensory, touch, cold, warm, and pain. And so you start getting a mixture of these sensations lack of or additional sensations. Like, oh, I've got numbness and tingling. That's kind of weird, right? You think about it, it's like, how do you have numbness and tingling? It's like, is it numb or is it tingling? Well, I know you can have both, right? And patients are like, I know what I got, right? So it's often not truly numb at that point, but it may be. You may have these perceptions of tingling because the nerves are firing because they're disturbed and irritated and disrupted, and they're not working to receive sensations well, but they're sending their own spontaneous ones that have nothing to do with what you're feeling. And so you've got numbness and tingling going on at the same time. And then eventually you get weakness and lack of reflexes. And so if you start to get weak, well, now that damage has gone really far. And it just takes longer to get it back. I would have told you 5 years ago, well, we can't get it back. It just is what it is. And to some degree that will be true. But now we know, we've seen people, we saw the story from Karen Hayes, right? You get that sensation back and now we can measure it. So that's pretty cool. All right. Motor nerves. We talked a little about control of movement of all muscles under conscious control, such as those used for walking, grasping things, or talking. But the cramps may start as a cramping instead of weakness. It may start this positive sensation, which doesn't feel very positive, but instead of a absence of, a presence of muscles tightening up more. So that'd be a cramping, or twitches, or things like that. But then you could get decreased muscle tone, decreased reflexes, and then muscle wasting when they just can't fire anymore properly, like this guy. Okay, then they have sensory nerves. This is kind of how it feels, right? Transmit information such as feeling of light touch, temperature, and pain from a cut or a poke. Symptoms include numbness and tingling, burning, stabbing, shooting, loss of balance, because you receive that information from your feet to know if you're wobbling or not, and coordination. So what does peripheral neuropathy feel like? Well, we talked a little bit about it. Numbness, prickling, or tingling. It's kind of like this, right? It's like all of that, or different times they feel that. I have a patient just saw today, and she said at 9 to 10 o'clock, starting around that time, the fire begins in my feet. And I forget exactly how she described it, but it was like misery.
Yeah.
So she says, I don't know what happens at 9:30, but that's when it starts. So, and then burning, freezing, throbbing, or shooting pain, often worse at night. Why is it worse at night?
I don't know, but it is.
Yeah, well, there's a couple reasons. So one, the other nerves actually inhibit the pain fibers. We talked about those big ones, like the sensory nerves. They come in and the big ones, they inhibit or block the pain ones. That's why when you hit your hand or squeeze, pinch it in something, you rub it, and it feels a little bit better, because you're causing those big sensory nerve fibers to block the pain fibers, which are little guys that are slower. So when you're moving, it actually works better. Yes, you're distracted, that helps too, but the movement actually decreases some of the pain through that neurological process. And if you lay down there, then that process stops, and the pain can go free. All right, finally, at the end, right, this is an ulcer. Yikes. So the numbness makes you unaware of cuts or nicks that lead to ulcers and amputations. We always have the option to keep doing what we've been doing, but if your condition is worsened to the point it is now, what will keep it from continuing? Sorry, what will keep your condition from continuing down the process if you just keep doing the same thing? So even with conventional medical wound care, which I strongly encourage, the options become limited. So let's not let it go there. Not even there. Not there. Okay. So what we do is we measure your sensory input. And so we do this with monofilaments. Anna usually does this. And they're basically like little fishing lines that bend at a particular pressure. And we say, do you feel that? Do you feel that? And if you do, okay, then you can feel that pressure. And then we go to lighter pressures. Can you feel that? No, I can't feel that one anymore. Okay, then we know exactly where it is. And as you get more, as you recover, then we can check you again and go, oh, you can feel that. Wow, you can feel that one, you can feel that one. Wow, you feel the lightest one. This is great. You are doing really well now. And we're excited with that. So most doctors just use that 10 gram to measure severe loss. Most doctors don't do it at all. But most doctors who do that, they use the 10 gram and they say, If you can feel that, then you're okay, which means you're not super in danger. And that's good. That's good for them to do that. Because what are they going to do otherwise?
It's out of their reach.
Yeah, they're not going to do anything because they don't do these therapies and they don't work on lifestyle recovery. And most people don't want to do the stuff that they need to do to get well, so doctors aren't going to argue with them. So, but if they get to this point, they're like, you are in serious trouble. You need to be looking at your feet every day, right? Warm cold perception testing, so we often will do this as well because that's another one of those nerves that can die, right? Vibration perception testing, that's another, this can be a spinal cord problem. Actually, vibration is two nerves coming together and comparing their sensations. So this happens in the spinal cord and the brain. Motor strength testing, because we want to see if those are being affected, and we can see if it gets better. So we do this with your toe. How strong is your toe?
Warm and cool perception testing.
Mm-hmm.
When I told you I have cold feet
Mm-hmm.
and cold hands, is that what we're talking about?
So, the question was, just having warm or cold feet, is this the same? No.
Okay.
So that's usually a blood flow thing, although it can be just a perception thing. But here we're testing, can you feel the touch of cold? So they can be somewhat related, but not exactly. All right, then the autonomic nerves, these are the scariest ones because these go to organs that regulate activities that people do not control consciously, such as breathing and digesting and heart rate and other gland functions. So your autonomic nervous system controls that. Most overlooked and misdiagnosed forms of neuropathy are these. Because it's hard. How do you measure the nerves to the organs? Well, we actually have a way to do that. It's called thermography. That's pretty cool. It controls all sorts of things, right? Rest, digest, repair, and development. That's primarily your parasympathetic nervous system function. And then the fight, flight, and freeze is sympathetic. Like, which one is good? Here's a trick question. Which one is good?
Depends on what it is. Digestion and repair and development is very good.
It is good.
But fight and flight and freeze is very good for a certain situation.
That's right. We need them both. Now we do want to spend more time here, but we want to be able to do this. And as we spend time here, we do have more capacity to do this. Now I'll make the screen so people can see up close. There you go. They can see the screen. Yeah. So we need them both. But we spend most people spend most of their time here, stressing out over stuff. Social media is stressful. News is stressful. Work is stressful. Home is stressful. Calgon, give me a break. You guys remember the commercials?
Yeah.
Calgon, take me away.
Yeah. So she's too young to remember Calgon. It was great. It was like a little bath salts, right? So, all right. And people don't have time for baths anymore. Nope, no time. It's Calgon. Nobody can buy Calgon anymore.
Costs too much to run.
That's right.
Water bath.
All right. So we need to spend more time over here. Even little bits of time can help us recover more. What else? Actually, adjustments help improve this. We'll talk a little bit about that, I believe. This is a graphic of autonomic nervous system. This is a vagus nerve, actually. It controls all sorts of things. This is a graphic of your diaphragm moving up and down in your heart. It goes down to intestines. So your vagus nerve is your rest, digest, and heal. Right? So now people, they'll go in and do surgery on some people, especially if they have like serious intestine problems. Do surgery and they'll put a wire around your vagus nerve and just electrocute it gently for a long time. And it actually really helps. So there's a device that I may get that's a little probe that you can activate the vagus nerve. You can from the outside. For certain people, that can be really helpful. There's things you can do like humming and gargling that actually activate your vagus nerve. Vibration here in the chest, that's why the humming does it, a deep hum. That actually activates your vagus nerve and it can help promote this healing process, this rest, digest, and heal. So maybe those monks were onto something, right?
Yeah.
Mm-hmm. All right, signs that you have autonomic dysfunction: poor sleep, diarrhea, irritable bowel syndrome, irritability, anxiety, excessive sweating, neurodevelopmental problems. That's high sympathetic, but also low parasympathetic is a problem constipation, depression, hormonal issues, chronic fatigue, fibromyalgia, etc. So you need a balance, right? You need this high enough and this low enough, but you got to have them both. So how does chiropractic affect autonomic nervous system function? It can be evaluated by measuring skin temperature. That's the thermography that our ladies evaluate people and does scans along the spine. These values can be used as a standard in assessment of sympathetic nerve function and the degree of asymmetry, imbalances between the sides, is a quantifiable indicator of dysfunction. There's some big words there. Basically, it means you scan the temperature along the surface of the spine. It actually helps you determine the amount of dysfunction of the nerves to the organs. You can't diagnose organ dysfunction with this, but you can diagnose the nerve function that goes to the organs, which then, of course, affects the health of the organs. This is an example of one, and this was done in May of 2023, and you can see this was really big up here. So what organs are involved here in C234? Well, you've got thyroid, you've got the other neck muscles, the swallowing muscles, but you also feeds into the brainstem up in here, and that affects profoundly the autonomic nervous system function, the breathing, the heart rate, the digestion. So anyway, so this is going on here. High intensity imbalances in the upper cervical brainstem area. Had some dysfunction here as well. So that was May of 2023. And then August, it's gone. That was pretty cool. Same person, right? Now there's still problems. This showed up, but not that really bad one. So that was really cool. So we can only see if there's a problem, then we can see if we're making progress, doing the right things to help it out. That's what we want to know, right? Are we doing the right things? And it's great to feel better. I think that's super important. But we also can go objectively, are we really making improvements, or is it just, you want to feel better, right? Which is cool if that works, but we like to be able to measure it too. Let's tell another story. This is a story of Ellen. So she was dependent on insulin, but she still had a love for life. Even medicated, her blood sugar was still not well under control. She came in with another elderly friend in similar circumstances, but not over fat. They had an offer from Fresno office. They were asked to and prepared to pay $10,000 each, which apparently was a 50% off special. Yikes. All right, so number one, what do we do? Step one was an eating program. The changes that occurred in their bodies from this weight loss and blood sugar control were impressive and dramatically slowed the progression of their neuropathy, but it didn't reverse it. They were actually stars in the community, at least among their doctors, right? They're like, you guys did amazing. And it was hard work, right? They did this ketogenic diet, and it is hard, right? And they did it well. And they got great results. But it didn't reverse the neuropathy. But it's key to control blood sugar if we are going to reverse the neuropathy. So what do we do to actually reverse some of it? Well, we did peripheral neuropathy specific treatment and continued home therapy and office therapy for 15 weeks. After reevaluation, we found dramatically reduced numbness, and she can now sleep without pain. That was super cool. Because that's really, it's like, I just want to sleep. Really, I don't care if numbness goes away, I don't care, whatever, I just want to sleep. And of course, sometimes medications can do that, which is why they give Neurontin and gabapentin. And sometimes it works. And sometimes it causes other problems. And sometimes it doesn't work. So, but we actually go, okay, we actually help the nerves heal, and you got better because of the healing. And that's really the way we like to work. Any comments or questions from the online people? All right. So what?
Somebody says, "Hey, what are we talking about here?"
So, well, hopefully they've got the picture by now.
And somebody else says, "This reminds me that beds are quite bad for our bodies."
All right. Yep. Well, that's
It's the same person.
not moving is bad. Yep. So you don't want to spend too long in bed. All right. You can just give me comments that are really I need to respond to. Okay. Causes of neuropathy. What are the causes? Because we can address the cause, then we can address the solution, right? So trauma.
Auto accident.
Yeah, auto accidents, that can do it, right? Repetitive stress, biomechanical pressure, That can be like, it's sitting at a desk for too long. It's not the frequent use of your fingers, it's the so little use of the rest of your body, right? You're just sitting there for hours and your body's not moving. That it builds up toxicity. Diabetes is really common. Nutritional or vitamin imbalances, alcoholism, exposure to toxins, autoimmune diseases. Gluten neuropathy is one of the most common causes of peripheral neuropathy. Diabetes is number one. Gluten neuropathy is close to the top after that. Chemotherapy can cause it. Chemotherapy is actually one of the favorite ones for us to treat because chemotherapy, typically you do it and then you stop. And so you're not continuing to damage your body with that, even though it did cause the damage. But if you stop damaging it, then it's a lot easier to help it recover. Right? With diabetes, if you don't control it really well, then you're continuing to damage it. Radiation, COVID, genetic hereditary neuropathies, liver, kidney problems. Kidney problems are an issue. We had a patient who was on dialysis, and that was making it worse. And she kept going to stay on dialysis. We actually were able to help her feel better by helping the nerves to heal. Our testing showed she was mostly the same, but she felt better, and we had done it naturally, and so that was really good. That was a success. And then once she could get her kidney fixed, then we could help her recover a lot more. All right, and prescription medications, really, what causes that? Well, not that anyone's taking these, but if someone were to take these kind of medications, they might cause neuropathy. Anybody out there taking something for heart or blood pressure? Yeah, like almost everybody. Drugs used for cholesterol? Okay, now we've included like 80% of the American population. To fight cancer, chemotherapy, right? We talked about that. Used to fight infections. What? Like antibiotics. Those can cause, some of them do sometimes, right? They can cause damage to your ear, to hearing. Some of them cause hearing loss. Now, it's not very common, but that does happen. But they also can cause neuropathy. So it's best, you do what you've got to do to save your life, but don't use these things unless you really have to. That's what it means. Drugs to treat autoimmune disease, to treat seizures, and we treat seizures a lot here in our office. We love that. Little kiddos have seizures. We treat them and help them not have seizures. Anti-alcohol drugs. Drugs to fight HIV and AIDS. All right, so prescription. The prescription is a long death. Feel better and get worse. That's what a lot of prescriptions do. You're like, well, as long as you can give me something that makes you feel better, then that must be better. Well, not if your condition continues to get worse. So what's a doctor to do? This doctor is saying no to the money. Patients demanding and paying for solutions that are quick, easy, and cheap. That's where we are, right? And it's not a problem to want something that's quick and easy and cheap. That's human nature, and that's fine nature. That's okay to ask for. Pharmaceutical sales reps and research publications, even the FDA approval and medical school costs are funded largely by drug companies themselves. Did you know the FDA is funded primarily by drug companies?
No.
So their approval process, to get a drug approved, you have to pay for it. Well, you have to pay for all the research, which can be millions of dollars. But then, once you get it, when it's approved by the FDA, you have to pay them to do it. Which is okay. We're like, well, if you want the FDA to work for you, you're going to need to pay for some of the money, so the Americans don't have to pay for it all. It's like, oh, that seems like a good idea. And then if you want it expedited, you pay more. Well, it is a little bit of conflict of interest, right, when you have the approvers getting paid by the ones who get one approval. So, and then when they quit working for the FDA, they go start working for the drug companies. It's like, yeah. Okay. So things have changing a little bit now, though, right? We have some new sheriff in town. But they have people they're working for too, right? Hopefully they're working for me, because I'm okay. And I don't have much money to give them, so they're not working for money. All All right, insurances and clinics demand cost cutting by seeing more people in shorter times. So doctors like, I want to help you out, and they're like, come on, let's go, next, come on, all right, because he's working for somebody else. Most doctors don't work for themselves. So what's the doctor do? When the occasional patient comes in and wants a natural solution, they aren't prepared, because nobody else has wanted it. They want quick solutions. The insurance company and the clinic owner are saying, let's get going, all right? And if you don't give the patient what they want, they're going to give you a bad review, all right? So, all kinds of stuff. So, did you know this information?
Some of it. No.
Yeah, this is pretty surprising stuff. So, how long have you had these symptoms? Think about that. How many doctors have you seen? Why weren't you told? Decades of consumers demanding quick fixes. That's part of the problem. I don't blame the doctors, except when they say, you're fine, there's nothing else you can do. What they should say is, you don't have an infection, disease, or trauma that can be effectively treated by drugs or surgery. That's what we do, but there's other approaches that may be helpful. That'd be great. They need to know they're not wellness doctors, they're disease doctors. I know I'm not a really good disease doctor. I'm a wellness doctor. Right? I don't prescribe medications, I don't do surgery. Some people need that, and they need to go somewhere else to do that. And doctors go, I give medications, drugs, and surgery. If you need to go somewhere to get well, and you don't have this infection, disease, or trauma, you need to go to somebody else. So it's pretty simple. Human nature and desire for not wasting time or effort, that's all of us. It makes us think, I want all my health care to look like this, quick, easy, and cheap. And drug companies say, we can meet that need if you'll pay us handsomely for it. Right? Long COVID, 61% of COVID-19 patients were seeking neuropathic pain treatments at the follow-up. That's a lot of people. Okay. Diabetes, 30 million people in the U.S. have diabetes. At least 50% of diabetic individuals will develop diabetic neuropathy. Exercise and dietary changes have shown to prevent and improve neuropathic pain. They don't necessarily improve the neuropathy, but remember that movement, those big nerve fibers, big sensory fibers block the pain fibers, so movement helps reduce pain. And it can promote healing, and we know how to do it. And sometimes you have to add other things, though. One thing isn't enough. So this is one of the nutritional. This provides the power to the healing process, especially as it relates to autoimmunity. So this test is for wheat or for gluten. And this patient had out of range, this is the normal range, up to 1.8, and they were somewhere above 2. What does that mean? The greater than 2. That means we couldn't measure higher than that, but we know you're higher than that. So this person was really reactive to wheat. Wheat is not their friend. Okay, so that's a wheat sensitivity. Now, but is it causing the neuropathy? Well, in this case, transglutaminase 3, yes, it probably was causing the neuropathy. This is an autoimmune reaction here. And these relate to different organs, skin and brain and nerves and gut. Okay. Deficiency, toxicity, dysbiosis, which is gut problems. Another test we do, this shows the high need for these antioxidants and for these B vitamins. We can test and find out if you are deficient, and then we can know for sure, what do you need? Are you getting enough of what you're supposed to have? Biomechanical alignment. So we said people with head-forward posture causes neuropathy in the hands. We said that so many you need nerve information that's activated by your spine to activate your brain. All right, so this is key. So if we find that there's problems in the spine, loss of curves, changes in the curvature put strain directly on spinal cord and on exiting spinal nerves. Postural stress, forehead posture increases pressure on the nerves at the spinal level. Malalignment or being out of alignment. Vertebrae can misalign due to trauma or repetitive stress causing direct or indirect pressure on the spinal cord and exiting spinal nerves and affects your brain function, which controls everything. So regardless of the type or cause of neuropathy, nervous system interference or dysfunction will always limit healing and optimal function. So we want the nerves to work well, the central nervous system to work well, so it can help the peripheral nervous system work well, regardless of the cause. Patients with mild to moderate carpal tunnel syndrome exhibited a greater forward head posture compared to healthy people. So posture affects your nerves. Forward head posture is strongly related to motor nerve conduction impairment. That's the nerves, not just your skin, but to the muscles. Forward head posture makes patients more prone to peripheral nerve entrapment. And this is the exciting part. It's like, okay, that's a problem. But then if you can correct it, it improved head posture, decreased pain, and increased the function of the nerves traveling from the neck to the hands. So that was a study done on the neck and the hands, probably true of the back and the legs as well, right? Vertebral subluxation is a misalignment of the spinal column which negatively affects nerve function. This is the back of the head. This is the most important area of the spine because there's so many nerves that pass through it, but also nerves that are all around it that feed back up into the brain, control brain function. I'm going to tell you a story about this lady. She was an 80-year-old lady. She had constant alternating diarrhea and constipation. She couldn't do her housework or care for her husband. So she went to the doctor, and the doctor said, I'm going to give you a prescription medication. I said, okay, thanks. Didn't really help. So he said, okay, well, let me take an x-ray, see what we can find. So he took an x-ray, and that didn't really help. Couldn't find anything. So what's the doctor looking for? Disease, right? So infection, disease, trauma. He's like, yeah, you've got some degeneration, you're an old lady, we kind of expect that, right? So then he took an MRI. So he's like, well, maybe it's a problem with your brain. Let's see if there's a problem with your brain. He's like, well, it's shrunk a little bit, but you're 80 years old. So, okay. So we give the doctor credit. He's actually really trying. Instead of just going, oh, hey, you know what, you're 80, what do you expect? So he's like, let's find a solution. So, give the doctor props for that. But he's looking for infection, disease, and trauma. And he couldn't find any. And so now he's like, well, we'll give you Vicodin. That'll help you feel a little better. It didn't. And so now she's feeling hopeless and miserable and medicated. So she comes to us because we're the last resort sometimes. We take an x-ray. And she's got 46 millimeters head forward posture. So that'll go. And then we treated her for a bit. And this is what happened to her neck. It got restored to a great degree. That was pretty cool. But for her, right, she's like, I don't care, right? Bowel movements were much improved. She was able to cook and clean, and she wasn't dependent on medication anymore. At 80 years old, she improved that much. How do we do that? We did adjustments on her spine, improved the biomechanics, and that improved autonomic nervous system function. Yeah. So life consequences of neuropathy. So the last 5 to 10 years, going places, doing things, enjoying life, think about how it's been for you. Your strength, your energy, your focus, your sleep, prescription side effects, are they getting worse? Are they getting better? Are they staying the same? So think about the next 5 to 10 years. If you do nothing for recovery, or just not enough, what does it look like? Well, 25% of people with diabetes will develop a foot ulcer. 90% of hospital admissions for diabetic foot ulcers are related to peripheral neuropathy and infection. So does it just run in your family? So this is a joke a friend of mine told. I don't know if this really happened, but so he's sitting on a plane, and you know when you get the middle seat, right, and there's like a really big person next to you, like they should bought a seat and a half, right, and they did. They get your half, and so sitting there, and there's a person over here too, right, and this guy over here, he's got his candy bar and his soda, and he's eating, and it's like a healthy candy bar, right? So, and he's very overweight, and he's got some diseases, and he's eating and he's talking. finds out this guy's into health. And so he's like, yeah, so I try to do what the right thing, I've got the diet soda and this healthy candy bar. And he says, but, as my dad had diabetes, my brother, he's got, heart disease, and, I think it just runs in the family. And my friend looked over at him, he said, the problem is, nobody runs in your family. So, all right. So the way you think organizes your behaviors. So this guy was just like, yeah, I must just run in my family. And I'm not going to try too hard because what can I do? There's no chance for me. And your behaviors will predict your outcomes. So thinking affects behaviors. Behaviors affect outcomes. It does matter. I mean, yeah, sometimes we get the short straw, we have bad genetics or something like that. If that happens, right? It just means we have to work harder. We just do the best we can with what we've got. So what are your options? If you have less neuropathy, let's think of something positive now. Spend more time with family, do more activities. What if you had all your health back? What would you do differently? Right? What would you do that you can't do or don't do the way you want to do now? And what would you do if you had your body back? If you could live the life you want to live. All right, one more story. We're about to wrap up here pretty soon. Middle-aged gentleman, working professional, and he loved to golf. He asked if there was anything I could do to help with neuropathy because he was getting worse and might start interfering with his golf. All right, that is pretty serious, right? It's like this is what he loved to do. All right, he was already making walking and sleep uncomfortable, right? But the golf was most important. It's like sleep I can do without, but golf, no. All right, so the problem is, he said, I am short on time. I'm a busy man. All right, so, we checked him out. We did an exam, and we found out he is not a diabetic. So that was not the problem. All right. He had not had radiation or medication or any known autoimmune cause. It's like, man, this guy's got nothing causing it. Right? Some areas were already halfway to the dangerous point. Right? It's a 5-gram myelin filament he couldn't feel. High risk level of sensory loss. When it gets to 0, the risk of infection and amputation raises dramatically. He understood the seriousness. He said he was willing to make time if he could really make improvements. Like, okay. We moved ahead with treatment to promote healing in the nerves. After a month, our testing showed that his sensation had already improved. That was pretty fast. Right? But he was doing a lot of good things for himself. He can now feel almost normally in areas where he could barely feel before. And that was amazing, but it's no longer surprising. So what does our peripheral neuropathy discovery process look like? So part 1, we do a neuropathy-specific history and neuropathy severity plus spinal screening. So, so your symptoms and history, clinical sensory motor score, what is that? That's when we do the monofilament testing, right? Find out exactly your degree of loss. Part 2, more structural and neurological testing about treatment, trauma, recovery history. There's other chemical, mental, or other things going on. And analyze metabolic assessment form. That's a questionnaire you'd fill out. More neurologic testing, checking your heart rate variability. That's your autonomic nervous system function, right? And computerized balance evaluation. We do the thermography scan to see how the nerves to the organs are working, et cetera, et cetera. We might do x-ray if needed. Functional lab testing, we do that a little later. That is looking for deficiencies, toxicities, gut health, a lot of other causes. So we're really super thorough, right? Complete evaluation costs, typically it's $375 for all this. So we actually do it for people who are listening or in person. We'll do this full evaluation for $125, not including the lab testing. Or if you have somebody that you want, you can extend this offer to them. That's a lot of stuff. So start with chiropractic spinal adjustments. So this is the treatment process. To remove the nerve interference and restore the nerve flow and communication. Sometimes this is a really big part of the solution. Photobiomodulate, easy for me to say, photobiomodulation. That's changing things through light. Body changes through light. 20 sessions over 10 weeks. It changes depending on the severity, but that's kind of a typical. In-office treatment, we use a laser and other things. At home, you'd use a high-energy red and infrared light therapy. And
What's that word?
infrared?
No. Ercon.
Oh, that's the brand name, sorry. Erconia is the name of the laser.
Oh.
Part 3, and oh, by the way, just in case you don't know, 635 nanometer, that's a red light. You actually don't even feel it. So it's not a cutting laser, it's a healing laser. The light energy goes into the cells, helps them make energy to recover and repair, just like sunlight goes into plant cells and helps them to grow. Part 3, nutritional testing, diet, supplementation. We give you personalized results and recommendations based on your lab testing. All right, part 4, progressive reevaluation. So we want to recheck and say, how are we going? Is there anything we need to change to make it go better? So thorough treatment cost for moderate severity, 6 months. This is the total cost. 6 months, $5,500, 12 months, $5,900, including lab interpretation. The cost to the lab is more, extra for any supplements. So that would be, we just estimate, we don't know for sure, right? But estimate $1,000 for a year of supplementation and treatment, right? Because a lot of these patients need a lot of supplements. All right, one last story. Mr. Castillo, 81 years old. He had foot pain and numbness for 12 years. And it was getting worse. So progressively worsening a week after his colonoscopy. So that was weird, right? So he had a colonoscopy and now I'm getting worse. So what happened? I don't know. Don't get a colonoscopy is what he said. No, he's no longer motivated to get up and move. He gave up walking almost entirely. He's taking gabapentin, but still he's at 10 out of 10, burning and electric-like pain at times. So less than 3 months into treatment, we've seen 50% improvement in nerve function and healing. So that's when we do our testing. It's like 50% better. That was super cool, right? 81-year-old guy. His wife says, I got my husband back. He's joining me again on walks and willing to go to social events again. He just kind of closed in, and you start doing that, and then you're more likely to get dementia, and then things just spiral out of control. That could have been the end of him, right? But it's not. Oh, and by the way, that was his neck. He had neck surgery. He was all screwed up, literally, right? So, yeah, even somebody in his head forward posture was 66 millimeters. Scary. And I couldn't do much about it because it was all screws in there.
If you took it out, could it have already mended to the position the screws were holding?
Yep.
But you can't cut in to take it out.
I try not to do that. No doctor tries to do that, actually, because then you're more likely to create new problems and you haven't created any solutions, right? Oh, that's the end. Yeah. Okay. So if you want to take advantage of this, let us know. Give us a call. I don't have the number up here, but you can find us. Synergy Chiropractic. Yeah. So for the special cost we gave here for this discounted initial evaluation, we'll do that for until the end of 2025. Right. So if you call us up, make the appointment. You don't have to get in by the end of the year, but you just have to make the appointment. All right. That's it. Any questions on there? Okay. All right. Thanks for joining us. We'll go ahead and shut this off here.